Hi, everyone. This is Anna Walton from the Tennessee Justice Center. Thank you for joining our webinar, Insure Our Kids, TennCare and Covered Kids Eligibility and Enrollment, the Basics. Insure Our Kids is a statewide campaign to enroll every eligible but uninsured child in the state of Tennessee. This webinar will be about an hour long, and there'll be time for questions at the end. So at any time, you can type questions into the question box on the side of the webinar. And we will be sending out a recording of this webinar and the slides as well. With that, I'll turn it over to the Director of Children's Health at TJC, Kanika Young.
Thank you, Anna, and thank you everyone for joining us today. We hope that this will be straightforward but helpful in your daily lives and routines as you are encountering children or pregnant women who could benefit from the information. We hope that you'll be able to connect with the message and share it with others in the community. So we'll just jump right in and start off by talking about what are the benefits of insurance for children. So studies have shown that children who have access to health care early off enjoy some long-term effects into adulthood. First off, if you have health insurance as a child, you are able to get preventative care and treatment for illnesses and early diagnosis of any sort of conditions that may delay your development. And so as a result, these children tend to do better in school. They then miss fewer school days due to illness or injury, and they are more likely to finish high school and go on to attend and even graduate from college. They also have fewer emergency room visits and hospitalizations as adults, and then earn more as adults because they are able to work and maintain their health and be able to provide for their families. So it starts a healthy cycle for kids to have that access to comprehensive care early on. What you may not know is that almost every child is eligible for something, and we are today talking about the free or low-cost programs that are available to children and pregnant women, and our focus is on TennCare and Covered Kids, but those two programs combine to insure over half of the children in the state of Tennessee. So we want to be sure that everybody who is eligible for these programs is aware of them and able to access them. So as I mentioned, we're talking about public coverage categories. So TennCare is the state's Medicaid program, Covered Kids is the state's CHIP program, and then there's a third program that's sort of a combination of the two that's called TennCare Standard. And so those are the three programs that we're going to be talking about more today. First up is TennCare. As I mentioned, this is Tennessee's Medicaid program. It's a federal-state partnership where the federal government provides the majority of the costs associated with the program, and the states have the responsibility of administering the program within certain federal guidelines. So, for example, the federal government may set rules about eligibility and give the state some options in terms of who it covers, and it also, the federal government would tell states what types of benefits must be provided and which types of benefits are optional for their enrollees. And then there is some state flexibility in terms of different ways of administering the program to the enrollees in the state. For example, work requirements is one thing that's a hot topic right now, where some states are opting to impose work requirements in their Medicaid programs, but it's not something that the federal government dictates. So that's just an example of the flexibility that states have with their different programs. A common saying amongst people who are working with Medicaid programs across the country is that if you've seen one state Medicaid program, you've seen one state Medicaid program, because they can all be different and do different things within their jurisdictions. So in Tennessee, we have about 1.5 million people are enrolled in TennCare, and over half of them are children. TennCare covers over half of all kids in Tennessee. It covers half of babies born in Tennessee, and it's a major source of funding for the state's network of neonatal intensive care units. Hospitals really rely on TennCare funding to be able to operate and maintain the technology and staffing that they need to care for babies who are born with significant illnesses and require that extra attention. It's also the single most important payer for services for children with severe healthcare needs, so it's really important to have this safety net available for people in the state. One of the things that's really great about TennCare is that there is a standard that is mandated from the federal government that is called EPSDT, which stands for Early Periodic Screening, Diagnostic, and Treatment. This essentially says that whatever a child needs, and child here we're referring to 18 and under, whatever they need, they are entitled to receive on Medicaid. So that means periodic or interperiodic assessments of growth and development, immunizations, lead poisoning testing, comprehensive vision, dental, hearing services, and all medically necessary diagnostic and treatment services. So essentially, TennCare can design its benefit package and say these are the things that are covered to sort of give people an idea of what they can access on the program. But if a doctor came along and said something was medically necessary and it wasn't exactly listed in the benefits package, it wouldn't matter for the child who needs that service. They would be able to get it under the EPSDT standard. So it's a really great feature of the TennCare program and Medicaid in general. Covered Kids is slightly different. It is Tennessee's CHIP program. CHIP stands for Children's Health Insurance Program, and this is also a federal-state partnership with the federal government paying almost or over 99% of the cost associated with Tennessee's CHIP-funded programs. Covered Kids is the program that provides health insurance for eligible children, 18 and younger, and for eligible pregnant women, regardless of immigration status. So this is key for pregnant women who are maybe not lawfully residing in the U.S., but they are about to give birth to a U.S. citizen. They can access Covered Kids, and they should not be penalized if they are not lawfully residing. So it's regardless of immigration status for pregnant women. In fiscal year 2017, there were over 103,000 children covered and enrolled in Covered Kids. That number is slightly down from fiscal year 2016 when it was almost 106,000 children. Not sure if that's a function of the economy being better and people being able to access other sources of insurance or what, but we have seen a slight decline in that number. But we do want to make sure that anybody who is in need of this coverage knows about it and can get enrolled. The Covered Kids benefits are not EPSDT standard, but they are still comprehensive. It's a low-cost comprehensive health coverage that's managed by Blue Cross Blue Shield of Tennessee. It's the Managed Care Organization, or MCO, that administers Covered Kids on behalf of the state of Tennessee. Covered Kids covers preventative health services, doctor visits, hospital visits, vaccinations, well-child visits, developmental screenings, and mental health. And children can also get vision and dental care for a different level in terms of the copay associated with that. There is a cost-sharing component for Covered Kids. There are no premiums, but the cost-sharing may be up to 5% of the family's income, and it varies depending on income and whatever service the child is or pregnant woman is accessing. But there is no cost-sharing for well baby and well child care, including immunizations. So the third public coverage category that we mentioned at the outset is TennCare Standard. This is a unique category. It is only for children under 19 that are on TennCare but become ineligible at some point. They can roll into TennCare Standard until they reach the age of 19. The TennCare Standard program is actually funded by CHIP funds, so that's why I said it's sort of a hybrid of TennCare and Covered Kids because of that funding structure, but it has the same benefit design as the TennCare program. Also, to access TennCare standard, the child must not have access to group health insurance. And by group, we mean employer-sponsored health care. It is not a bar to accessing TennCare standard if the person has parents, for example, that have individual plans that they purchase on the healthcare exchange. So this is specifically employer-sponsored group health insurance. They can't have access to that. Another criteria for TennCare standard is that the child be a U.S. citizen, U.S. national, or eligible non-citizen. So this does take into account immigration status of the child. And they must be below 211% of the federal poverty level. That's what FPL stands for. And that translates to about $52,000 for a family of 4. If they are above that income level, they can still qualify for TennCare standard if they have a qualifying medical condition that would have prevented them from getting health insurance prior to the Affordable Care Act. So what a lot of people like about the Affordable Care Act is that it did away with allowing insurance companies to underwrite their health insurance by looking at things like pre-existing medical conditions or age or sex, and charging more or rejecting applicants because of their status. So when it refers to a condition that would prevent them from getting health insurance prior to the Affordable Care Act, that's what we're talking about. So things that would have allowed a insurance company to deny someone insurance are the types of medical conditions that are looked at and considered qualifying medical conditions for TennCare standard for those who are above that income limit. So those are very serious illnesses like cerebral palsy, congestive heart failure, lead poisoning, and even juvenile diabetes, just as an example. There are roughly 1.5 million children in Tennessee as of the last census count. So looking at how the kids in Tennessee get coverage, you see that TennCare is the largest provider, covering over 770,000 children. These are fiscal year 2017 numbers. TennCare actually tracks their enrollment on a monthly basis. So that number is as of June of 2018, but the rest of the numbers are looking at fiscal year 2017. So they may not add up exactly to the total because you're looking at different sources that have different reporting periods, but this gives you a rough idea of how many children are in each program. And it's also important to note that the number of kids who are currently on TennCare is going to change from month to month because it's a safety net program that is there for families when they fall on hard times. So you may have 1 month where a parent loses a job and they qualify for TennCare and their child enrolls, but then they find a job or they get a promotion and they're above the income level, so they're no longer on TennCare and they roll off the program. So it's a really cyclical type of situation with the enrollment numbers. The TennCare Standard program covers over 103,000 people. The marketplace is roughly 21,000, and then the next largest coverage source after TennCare would be employer-sponsored. So those are children who are listed as dependents on their parents' plan. What we want to focus on, though, is the uninsured number. We want to drive that number down as close to 0 as possible by educating people about TennCare and Cover Kids. So right now, we have about 53,000 children who are uninsured, and of that number, over 34,000 qualify based on their income level for TennCare or Cover Kids. And so that's the number we're trying to target. The kids who are not eligible, you may be asking, okay, well, what about, the difference between the 53 and the 34? We are aware that there are some barriers that, we wouldn't be able to address just through enrolling people in TennCare and Cover Kids that would make them not eligible. That would be children who are not citizens of Tennessee. If they were born somewhere else and they immigrated here, they have to wait 5 years to enroll in any sort of public coverage programs. And kids who are above income limit may not have the option of these programs, so that accounts for that difference in who's uninsured, uninsured, and who's eligible but uninsured. So looking at a map of Tennessee, this is color-coded to give you an idea of which counties have the highest rates of uninsured children. And so the highest top three are Shelby, Davidson, and Knox, which may not be surprising because they are the most populated counties. And you can see in the dark orange those counties that have the highest rates. So we want to really reach providers and people who are working with children and pregnant women in those areas that have the highest need to make sure that they have this information and they can get connected to enrollment assistance for the children and pregnant women who are there. So there's some complicated math that goes into deciding who's eligible for these programs. This is just a chart that gives you an idea of how the different income levels correspond to the dollar amounts on a monthly and a yearly basis, and then it varies by family size. And so the percentages across the top are the percentage of the federal poverty level that is the cutoff for certain programs. So as we look at the different categories, you can refer back here to say, okay, well, what is 211% of federal poverty, to give you an idea of the income levels for people who can qualify for the program. The eligibility for these public coverage options not only looks at the income of the applicant, but also their category. So everybody who's eligible has to fit within a category and be below income to enroll in the program. For children, there are several income levels that are considered, and children are represented on this chart in the gray bars. So the gray color shows you the TennCare income levels, and then as you get into the purple sections, that is for covered kids. So looking at a newborn, for example, in that first column, they can qualify if they have incomes up to 195% of the federal poverty level, and covered kids would kick in once you get above that to cover those children up to age 1, for example. The fourth bar is for medically needy spin down, and we'll talk more about that later. But the reason why that arrow extends beyond 250% of the federal poverty level is that families who are above that income level would be able to spend down in order to come within the cutoff for the TennCare program, and that's for qualifying medical bills related to any ongoing health conditions that they may have. The other categories that we want to look at are pregnant women, which is the blue column, and another one that is not as widely known about is the orange bar that represents formal foster care up to age 26. So one of the popular features of the Affordable Care Act was that parents could keep their children on their health insurance plans through age 26. And so this is just a companion provision for foster children who are aging out of foster care. If they were on TennCare at the time that they turn 18, then they can stay on until 26. And even if they didn't know about it and they aged out of the system and they let their TennCare coverage lapse, they can still reapply until age 26 to have TennCare. So let's look at some hypotheticals just to illustrate the eligibility limits on the programs. So here's Eli and his daughter, Amy. Eli is 28 and Amy is 5. They recently, their monthly household income recently bumped from $1,300 to $2,750. They don't have any other resources. And so the question is, what coverage option would be available for Eli or Amy? Unfortunately, Eli is over the age for the TennCare or Covered Kids program. He doesn't fit within any of those categories. But Amy, who's 5 years old, she could qualify for TennCare, but for the income bump that put them above the limit. So if Amy is enrolled in TennCare, and then the income changes to bump them and make her no longer eligible, she can roll into TennCare Standard. Again, TennCare Standard is for children who lose TennCare, for example, due to an increase in the parent's income and they don't have access to any employer-sponsored insurance. So because the $2,750 is below the income level for a family size of 2, she can qualify for TennCare Standard. If she were over that income, then TennCare would send a medical determination packet that has to be returned within 60 days so that they could see if she has the qualifying medical condition that would allow her to still get the program. So TennCare Standard is the option for Amy in that situation. Medically needy spend down, as I mentioned earlier, is available for people who have significant healthcare expenses, but their incomes are above the income cutoff for the program. So for medically needy spend down, you look at the monthly income and you subtract any medical related expenses to see if the family comes within the spend down limit. And it's important to know that it's for anyone's medical bills in the household. It doesn't have to be specifically for the applicant. For example, if you have a child who is in a household and the brother or a father in the family has significant medical bills, those bills would still count to subtract from the household's monthly income to see if they can come within the spend down limit. Medical expenses that could be counted, it's a wide variety of things. So it includes health insurance, monthly health insurance premiums, any over-the-counter drugs up to a certain limit, any drugs ordered by a doctor, dental costs, doctor's costs, even the cost of driving back and forth to appointments. You can calculate the mileage equivalent and count that as a medical expense in order to come within the limit. So there's a lot of flexibility there to help families who are struggling with high medical expenses and they need an option for health insurance coverage. Our next hypothetical looks at the Jetsons. So let's look at Elroy. He's 10 years old. They have a monthly income of $4,500, and Elroy has medical bills of around $150. Judy has $2,000. Jane has $1,700, and George has $150 a month in prescriptions. And they have resources of $3,800 in the bank. So their household size is 4. Rosie the robot does not count for purposes of calculating TennCare eligibility. And so you look at the monthly cutoff for a family of 4, and you see that they are a little above the monthly income count for that category family size. And they have that $3,800 in the bank. So what options are available to Elroy in this case? Well, you would then refer back to medically needy spend down, because when you add up all of their medical bills and subtract it from their income, that brings them within the income limit for a family size of 4. And so Elroy could get medically needy spend down in that situation. A third example would be Catherine. She is a newborn, 2 months old. She's been in the NICU since birth, and her parents' income is over $9,000 a month, and they have $1,500 in the bank. Referring back to the income chart, you see that they are well above the income limits, and spend down may not be an option for them, but there is another option that is available that is called institutional TennCare. So the way that works is for children who are institutionalized, so that could be in a hospital or in a skilled nursing facility or other type of institution for more than 30 days, their parents' income is not considered for determining their eligibility for the program. So you would just look at the newborn or the child's income in that situation where they have been hospitalized for more than 30 days. And once you factor out the parent's income, Catherine, the 2-month-old, doesn't have income, and so she would qualify for institutional TennCare. To illustrate this even more, we have a real-life example. Sheila and Jase Hobbs, they were clients of the Tennessee Justice Center. Jase was born prematurely. His biological mother struggled with drug addiction, and he spent the first 10 weeks of his life at the NICU. Sheila Hobbs came along, and she and her husband, Dave, adopted Jase in 2016. Jase continued to have significant health needs, and in April of 2017, he was admitted to Vanderbilt Children's Hospital for surgery to treat a seizure disorder. As he was in the hospital, he developed difficulty breathing and required another surgery to place a breathing tube, and he spent another 2 months in the hospital. Well, after 2 months, he was well enough to go home, but his doctor said that he needed home nursing care in order to stay safe and healthy. Unfortunately, Sheila and her husband, Dave, had an ACA plan that did not cover the home nursing care that Jase would need, and the cost for such care is about $20,000 a month, and paying out of pocket for this family was simply out of the question. So for almost 5 months, Sheila Hobbs struggled to find a solution to enable her to take her son home. She tried calling different agencies, tried coordinating with hospital staff, and it was just really hard for her to figure out a way to get him home. Luckily, a social worker, actually put Ms. Hobbs in touch with the Tennessee Justice Center, and a few weeks later, he was approved for institutional TennCare. Again, because he had been institutionalized for more than 30 days, his parents' income was no longer considered to determine his eligibility for the program. Once he got institutional TennCare, his family was able to take him home, and he was able to roll into TennCare Standard because, again, TennCare Standard is a program for children who are on TennCare, but then they lose their eligibility status because of a change. Because once he left the hospital, he's no longer institutionalized, so then his parents' income would be considered, and that would have kicked him off of TennCare, allowing him to roll into TennCare Standard when he left the hospital. And even though their income was still above the 211% of federal poverty level, that is the cutoff for TennCare Standard, he could qualify because he had several qualifying health conditions and no access to an employer-sponsored insurance plan. Jase can remain on TennCare Standard until he turns 19 years old. So this has been a life-saving program for the Hobbs family. Looking at the uninsured children across the state, it's important to understand that it impacts children at all income levels. As of 2016, you see that 2% of the uninsured children are above 300% of federal poverty level. Depending on their family's situation in terms of medical bills, those kids could spend down to come within the income limits for the program. Another 4 to 5% of children fall in all of these different poverty level categories, and they definitely should be able to qualify for the program. So this just gives you an idea of how this could be important for people from all walks of life. In terms of the age breakdown, you see that 4% of the uninsured children are older, between the ages of 6 and 17. So part of our focus is to really meet those kids where they are. A lot of them would learn about or could learn about these options in school. So we really want to be in tune with school administrators, people such as school nurses, teachers, principals, who can share this information with the students that are coming through, and also connect them to the enrollment assistance that could get them enrolled. The enrollment period for TennCare and Covered Kids is open year-round. A lot of people may be familiar with the open enrollment periods that are special for Affordable Care Act plans or for employer-sponsored plans where you can only enroll at certain times of the year, that doesn't apply for TennCare and TennCare Standard. They can enroll at any point when they have a need for the program and when they qualify. The way that you enroll in Tennessee is through healthcare.gov. Unfortunately, Tennessee does not have its own application portal. Everybody must go to healthcare.gov to not only apply for ACA plans, but also for TennCare and Cover Kids. We have been told for several years now that the computer program is in progress. They hope to go live in 2019 with a new system called TEDS. So it remains to be seen whether Tennessee will start being able to accept applications and screen people for these different programs. But for now, everybody has to go through healthcare.gov except for a couple of categories that we'll talk a little bit more about in the next few slides. But we want to highlight this to say that healthcare.gov was not really designed to screen people for all the different categories of coverage that may be available to them. And so it's important that people have assistance when they're going through this process to make sure that they're not being overlooked or missed or sent down the wrong pathway when they try to go it alone. It's really complicated. The TennCare manual that talks about different eligibility categories, it's over 520 pages. So there's a lot of information. We don't expect everyone to be experts in this, but we want to make sure that people know who the experts are and can get in touch with them. Just to give you an idea of what type of information is required when you fill out an application on healthcare.gov, you have the basic things like name and information about everyone in your household. But one thing we want to point out is that for employer and income information, sworn statements can be used for people who are unemployed or don't have verifiable earnings. Some people think, oh, I don't have a W-2, I don't get, a pay stub, so I can't prove my income. It's okay to submit a sworn statement in lieu of other types of documentation for those who may be paid in cash or who may be unemployed. So that should not stop anyone from applying. And then the application checklist is continued on this next page. It's important for people to gather this information to help speed up the process of enrolling, to make sure that they are providing a good picture of their situation in their household. So I mentioned before that there are a couple of categories that are different in terms of the enrollment process, and so we just listed three here that are relevant to newborns. So there's TennCare Deeming, Cover Kids Deeming, and Newborn Presumptive Eligibility, and so we'll talk about each of these. So TennCare Deeming is for moms who are on TennCare. Their child is deemed eligible for TennCare for 1 year. The coverage starts on the date of birth for the child, and the way that they would get enrolled is to call the Tennessee Health Connection at the number listed. They would be able to make sure that the newborn gets an insurance card so the mom can use that as she's taking the child for their different checkups throughout that first year. For Cover Kids, it's very similar, except that coverage starts from the date the mother enrolled in Cover Kids. So it's important for pregnant women to get enrolled as soon as possible so they can start getting their prenatal checkups and make sure that their child, once he or she is born, is allowed to be on Cover Kids for the first 12 months of their life. And the way that they would enroll for Cover Kids Deeming is to call Cover Kids to report the birth of the child at the number listed. So it's slightly different from TennCare in that regard. And then the next category that's a little different in terms of enrollment is for newborn presumptive eligibility. This is for babies 12 months and younger who are born to mothers who are on private insurance or no insurance. The coverage would start on the date of application for that newborn, and the way that they would apply is to call the Tennessee Health Connection and enroll the child in the presumptive eligibility. But it's important for parents to know that they must still do an application on healthcare.gov for the child. The newborn presumptive eligibility is basically just something to hold the place of the child and make sure that they're getting the care they need while the application is pending on healthcare.gov. So the child will remain eligible until there's a final determination on the full application. A couple of best practices to keep in mind with regard to TennCare and Covered Kids enrollment is to remember to sign all documents. In speaking with the TennCare Bureau, they say that a common reason that applications are delayed or rejected is because it's missing a signature, or they may not answer all questions. So it's important to answer every question or write not applicable on the application. It's also important to open all mail from TennCare. We've heard about several families who have lost their TennCare coverage during the redetermination process that TennCare started recently, and that has been a big ordeal because sometimes TennCare has sent the renewal packet, to the wrong address, and the person has not gotten it in a timely fashion, or if they got the packet, it wasn't clear that it was from TennCare or that it was related to their TennCare coverage, so they may not have paid attention to it. So it's important to open all mail and make sure that you're not missing some important communication from TennCare to make sure that your coverage doesn't lapse, and respond to those inquiries from TennCare in a timely fashion, and make sure that TennCare knows your current address at all times so that they can reach you to convey any important information about the coverage. So these are just some best practices for people who are navigating the TennCare system. So I've talked a lot or mentioned a lot about enrollment assistance, and that's where the Insure Our Kids campaign comes in. We know that this information can be complicated and maybe overwhelming for people who don't deal with it on a day-to-day basis. So we want to make sure that people know that there's help out there. If you or someone you know needs help applying for TennCare Covered Kids, the Tennessee Healthcare Campaign has partnered with us and offered their Get Covered line, which is the 844 number on the screen right now. They will answer calls from the public and screen the caller to see if they may be eligible for any of these programs, and they will either help them apply or refer them to Family and Children's Service. Family and Children's Service is not DCS or any state agency. It's actually a nonprofit organization just with a similar name, and they have funding from the federal government to have trained navigators helping people navigate the healthcare.gov site. And so callers who are screened and may be eligible for the programs are connected with a local Family and Children's Service navigator who can meet with them and help them fill out the application. And for people who have already been enrolled in TennCare, or if they've been denied and they think that the decision was inaccurate, they can call the Tennessee Justice Center at the toll-free number listed here to get free help with filing an appeal of that determination from TennCare. So these are the agencies that are organizations that are working to help the public get enrolled and make sure that they are properly determined if they're eligible for the program. As I mentioned before, there are a few barriers that we are aware of that we just want to mention, but if you are aware of others that aren't listed here, we would love to hear about them and see if there's anything that we can do. Specifically for income, there's one option for children with significant healthcare needs who are in higher income households that Tennessee is not currently taking advantage of. And that's something that's called the Katie Beckett waiver, or other equivalent programs that the federal government allows as options for states to extend Medicaid coverage to children with significant health care needs. Tennessee is the only state right now that does not have the Katie Beckett waiver or anything similar to allow these families to access Medicaid coverage for their children. And we are currently working on trying to change that. So as of now, for those families, income is still a barrier. Immigration status, as I mentioned earlier, can be a barrier for children who were not born here and who have been present for less than 5 years. Even if they're lawfully immigrating to the United States, they still have to be residing for 5 years before they can access the program. And so there's not currently a way around that in Tennessee, although other states have taken advantage of the option to make an exception from this case. So the federal government sets this rule, but it does allow states to opt out of it, and Tennessee has just not chosen to opt out of it. Parent switching employers, we know that sometimes when you start a new job, there's like a probation period where your benefits don't kick in, and so we want people to be aware that these programs are available for short-term coverage. So if you are in that situation or you know people in that situation, we don't think that this has to be a barrier. You can try to get your child enrolled when they are in that period of not having access to coverage or not being able to be on their parent's plan. The family glitch. This is referring to a situation created under the Affordable Care Act where, for purposes of determining who qualifies for premium assistance or cost-sharing assistance on the Affordable Care Act plan, the calculation does not factor in the cost of adding dependents to the employer-sponsored plan. It's just looking at how much does it cost the employee to sign up for the plan. And so if that is deemed affordable, then they may not be able to access that extra premium assistance, and it would keep them from being able to afford putting their child on the plan. We have good reason to believe that the drafters of the Affordable Care Act did not anticipate that situation. It's a matter of interpretation, but the administration has not clarified that interpretation, and so the family glitch is still a barrier for some people. And then death of a parent. This is a situation where the child is, is in turmoil. Things are a little chaotic, and maybe another family member steps in to care for the child. We think it's important for adoptive parents to know that they can include TennCare as a provision in their adoption assistance agreements when they go through the process of adopting a child. And that is a provision under something called Title 4E of the Social Security Act. And this is for children who are being adopted with special needs, allowing them to access Medicaid. So this may be an option for some people who are adopting kids. If you are aware of other barriers, again, we would love to hear from you and see if there's something that we can do about the barrier or a workaround. So lastly, we want to highlight and thank our partners on the Insure Our Kids campaign. As you can see, we have a great list of organizations who have committed to spreading the word about the campaign and getting people connected to the assistance that they need across the state. This is not just a Nashville thing. We are trying to reach out to people all over the state to help them get access to the information that can help get children and pregnant women enrolled. And we'll actually be in Memphis on July 19th. For an in-person training. So if you know people in the Memphis area who you think would be interested in the information, you can direct them to insureourkids.org, and they can get connected to the campaign. Again, you can visit insureourkids.org for more information and to respond for the event in Memphis if you'd like to attend that. And all of the slides will be shared after the webinar, just as a reminder. So if you missed anything, you can go back and look at the slides to get that information. So now if anybody has any questions, we can open it up to questions. Just type it into the chat box, and we'd be happy to answer them if we can. So we'll just wait a couple of minutes to see if anybody has any questions. So far, we're not seeing any, but you still have a few minutes. So if there are any questions, feel free. If you want to, again, a recording of the webinar will be made available, but if you know of other people who may benefit from the information, again, go to insureourkids.org, and there will be a place there to sign up for the next webinar. We do this same webinar every second Thursday at 11 o'clock. So for anyone who wasn't able to attend today, feel free to let them know that they can catch it next month. And so with that, we still don't have any questions. So I want to thank you for your time today. Hope to hear from you. We hope this was helpful, and if you have any questions, feel free to reach out.
Thank you.
Thanks, everybody. Have a good day.